A fundamental part of this model, Innovation MD model, is that humans really are each highly complex biological laboratories, and they have to be treated as such. And certainly when it comes to pain scenarios. And so the goal is to be individualized in your assessment and your treatment plan and be able to draw on a wide variety of tools, bring them together in a symphony-like fashion to give that individual their best results. The tools available in the insurance covered toolbox are very helpful to a lot of people, but they're not helpful to everybody for sure. And there is another set of tools that are outside what insurance will cover that I began exploring several years ago, mainly in the form of regenerative-based injections. Basically, I started working with platelet-rich plasma, which essentially is taking the patient's blood, spinning it in a centrifuge, and extracting the platelet-rich contents. And the platelets are filled with several very important chemicals which help, to put it simply, jumpstart or harness the body's intrinsic healing mechanisms. And I was immediately impressed. The very first treatment I did, I was really impressed. And as I told patients at that time, when I was discussing that this wasn't covered under insurance, as I told them, you know, there's no quicker way to get you to hate me than charge you cash for something that doesn't work. So I assure you, if I did not have confidence in this as a treatment, I would not be delivering it. I myself have undergone multiple platelet-rich plasma-based treatments, and they have all been helpful. So I began then to think about a whole practice model, not only built around these regenerative treatments, but a larger model which really focused at its core on optimizing lifestyle. Because if lifestyle came as a pill, it would be the most powerful, far-reaching drug available. People don't think about it that way, but that's how they really should think about it. I wanted to make that concept the core and then have aspects of regenerative medicine, functional medicine, integrative medicine, alternative medicine, all pointing and supporting that core. So people often come in and they want fix me. And really pain is, at least in my experience, the great majority of the time, a management scenario. Basically, the best way to avoid pain and manage pain if you have to deal with pain is to maximize your wellness. The essential components of lifestyle and that you can modify are going to be what you eat and drink, what you do with your body, and in terms of movement and exercise, and what you do with your mind. Those are the major three modifiable components of lifestyle. And when you have all those working for you as best they can, that puts you in a much better position to not have a pain flare-up. And if you do have a pain type flare-up, it puts you in a much better position to respond to the array of treatments that you would be getting. We will be using treatments that are based in light, so-called photobiomodulation treatments, which utilize particular wavelengths in the red light spectrum, which have been shown, lots of scientific data and data about the mechanism of action, that photobiomodulation can be very helpful in promoting healing. The same is true for pulsed electromagnetic type waves. I have undergone treatments that had components of ozone, platelet-rich plasma, bone marrow-derived tissue, of fat-derived tissue, both of which came from me, as well as what are called biologic allografts, which are materials that come from the umbilical cord and amniotic membrane. So basically, the full gamut of materials that can be injected for pro-healing purposes. And I have to say, they all have had their place in being helpful. There is no one standout treatment, which is exactly why I don't want to build this around one particular type of treatment, because it's really, the key is being able to bring them all together for someone and have each of them amplify the other.